Welcome to the reassessment activity of oral anticoagulants listed in the Ministry of Health Medicine's formulary. Reassessment of formulary is an ongoing process of reviewing the drugs that have been listed in the standard formulary in comparisons to the similar alternatives in the formulary. It is important because we want to ensure efficient use of health resources at all times and to update formulary information based on the current treatment needs. In many situations, a reassessment activity can result in change of prescriber category, prescribing restriction and removal of drug from the formulary. You might wonder if we have done reassessment before. The answer is yes. The Formulary Management Branch has been doing reassessment since year 2012, beginning with statins, which we saw the removal of lower statin from the Ministry of Health Medicine's formulary. The latest reassessment was done in year 2018 on respiratory inhalers, where a number of changes were made in the formulary. This round, we are going to reassess oral anticoagulants that are listed in the Ministry of Health Medicine's formulary. The reassessment of oral anticoagulants is based on two reasons. First, it was officially requested by the key clinical experts for the Formulary Management Branch to review all direct oral anticoagulants listed in the formulary in terms of their indications based on efficacy, safety, and cost against warfarin. And second, there was request from the product registration holder for apixaban to revisit its listed indication and prescribing restriction. Therefore, it was decided that a comprehensive and systematic evaluation should be conducted in order to reassess all indications approved for oral anticoagulants in the formulary. Currently, we have 4 oral anticoagulants in the Ministry of Health Medicine's formulary: rivaroxaban, apixaban, dabigatran, and warfarin. For this reassessment activity, we aim to develop 3 frameworks of oral anticoagulants according to the registered indications using the method Multiple Criteria Decision Analysis (MCDA), to rank oral anticoagulants using the developed MCDA framework, and to revisit the prescribing restriction imposed on oral anticoagulant. Now, let me give you a brief overview of Multiple Criteria Decision Analysis. Multiple Criteria Decision Analysis, or MCDA, is a structured process of structuring complex decisions using multiple criteria, and it involves explicit weightage and scorings. The advantages of using MCDA for a reassessment are that MCDA formally incorporates stakeholders' preferences and it is able to override individual judgment. Let's have a look on how MCDA is to be done.
You want to know how multi-criteria decision analysis works? Just imagine you've been asked to buy fruits for the whole family, and you're looking for bananas. You go to the fruit store and there are all kinds of different bananas. Very yellow ones, green ones, ripe bananas, small bananas, and those which should have been eaten yesterday. Which one should you choose? The cheapest? But look at those in more detail. These are too old, they're bad quality. The other cheap ones are too small, and actually they're not that cheap at all. The yellow ones look perfect, but they cost a lot of money. One smells delicious and it comes at a special price, but we must eat it immediately. The green ones we can keep for a long time, but the taste is uncertain. There are so many criteria to consider, and there seem to be trade-offs between these choices. This is where you can use an MCDA. Multiple Criteria Decision Analysis. So how does MCDA work? Let me explain it stepwise. The first important step is to define your objective. What do you want to achieve? For example, to find those bananas which give you the best value for money. Then you need to define criteria which help to measure the value for money of bananas. Price is important to you, but there are others. Smell, origin, durability, the cost effectiveness, and quality. Next, you need to consider how important each of the criteria is to you. Quality could be the most important and influence 35% of your decision. Shelf life is also important to you. Price per kilogram, price, and smell are all somewhat important, and where they come from or how they were grown. Now you list your choices of bananas and rate each of them for each criterion. The best performing option gets the highest number of points, and the worst performing option the lowest, 2, 1, and 0. Now you can see that it's not always the same banana which performs best, and you have to accept a few trade-offs. Now we need to calculate. Each rating is multiplied by the weight of the criterion to determine the score for each option and criterion. Then you add up all the scores for each banana option. Then you select the winner banana. Here it's the middle one, which smells so nice but will have to be eaten soon. You could also decide to buy a mix of the 2 or 3 best performers. Now, you may wonder what that means for making decisions on medicines. Well, there's a lot of similarity in the decision process. You want those medicines helping you to achieve your healthcare objectives, which may be to improve health of your population to ensure safety of and access to therapies. The evaluation criteria could be relating to the product, such as the proof for bioequivalence, or the formulation of the packaging. The manufacturer, are they GMP certified? What's their supplier reliability track record, or do they invest locally? The service, do they maintain a pharmacovigilance database in your country? Do they offer valuable services to the patients or to pharmacists? And to value, which evidence proves the cost-effectiveness of the product? Are there good data on patient health outcomes? With this, you can build your MCDA framework. Together with the stakeholders concerned by your decision, you weight the importance of your criteria. Then you can test and use the evaluation to assess which of your options performs best versus your criteria. MCDA offers a well-structured decision process for drug procurement, formulary listing, reimbursement, and pricing, which is robust and transparent towards all stakeholders.
Briefly in words, MCDA consists of these steps. It starts with identifying and defining the criteria, determine the performance scales of criteria, determine the weights of each criterion, determine scores for the performance scales of criteria, measure the performance of drug, calculate the score of the drug for the criterion, and lastly, calculate the grand total score of the alternatives or drugs. In this reassessment, we will be involving consultants and specialists from 4 different disciplines: cardiology, hematology, general medicines, orthopedics, and also pharmacists. These stakeholders are expected to participate in this activity from the beginning till the end, which takes about 7 steps. On 19 August 2020, a meeting with some of the stakeholders, including members of the Technical Drug Working Committee, TDWC, cardiology, hematology, orthopedics, general medicines, and pharmacists, was held to identify relevant criteria and the performance scales for reassessing oral anticoagulants. Although the criteria has been identified, it still needs to be validated or agreed by other relevant stakeholders such as you. Therefore, it is our pleasure to invite you to participate in this survey, which aims to get an agreement on the identified criteria. Your involvement is very much appreciated as it can greatly facilitate the next steps ahead in this project. Please click on the next button after this video has ended. Thank you very much for your kind attention.